is Jamie. If you're not aware, I am the Vice President of Education here at the James L. West Center. In the James L. West Center, we are a long-term care community that serves persons impacted by dementia. And we do this in a variety of services. One is our long-term care community. We are able to serve 100 residents here in our building. We have one building here located close to downtown Fort Worth. So as we have those residents that live with us, we serve them and their families and friends that surround those loved ones. We do have respite care that we can do a short-term stay as well, depending on availability. And we also have a day program. Our day program has been around just as long as the West Center has, a little bit longer. We're going to celebrate our 30th year next year. Our day program unfortunately did close because of COVID, but we are actively and working very hard to get that open again. We're actually able to purchase a different building close to Southwest Fort Worth to open that day program and really be able to serve more participants. It's a larger building, so we can serve more participants that come during the day. If you want to learn more about the day program and kind of the progress we're at, we can get you on an email list where we're sending updates on what the progress is, applications, all the details about around the day program. And I'm happy to share that information and make sure you get on that email list if you're interested. Just let us know, because we want to make sure that y'all are getting all the resources that you need. Of course, we also do our education that y'all are taking advantage of today. We are proud to be celebrating our 10th year in education. Myself and Holly Glover, you may know, we are our education department here at the James L. West Center, and we offer over 100 different programs and support groups. I would say we probably average about 2 to 3 programs and support groups every week. So we like to consider ourselves partners in care for families and professionals that are serving somebody impacted with dementia, whether through its actual education and skill building, but also the supportive services that we can offer. And again, you'll get more information on that. I'm going to share my screen with everybody. You'll get the slides this afternoon, but I want to dive into this information about sleep disturbances and sundowning. This is a topic that is, it's needed because it's they're both, I guess, quote unquote, behaviors that persons with dementia commonly exhibit. Both of these really play into each other. We're going to learn more about that, but in how really disruptive they can be. So we are going to talk about identifying common symptoms, what causes this, what does it look like when somebody has sundowning or any sleep disturbances, but then really dive into how can I potentially prevent some of these behaviors, or how can I better manage them when they are presented. And really on the person that living with dementia, how can we better manage them and the symptoms and expressions they exhibit, but also on the care partner side, whether you're a professional or you are a family member, how can I better manage myself to provide better care for that person living with dementia? This is our course outline for the CE credits and the learning objectives I've just went over. So knowing that sleep disturbances are very common. So the National Library of Medicine has suggested that about a quarter of persons living with dementia will experience a sleep disturbance at some point. Generally, they happen in the mid stage of dementia. And this is really any type of dementia. So they're heavily present in persons that have Alzheimer's disease type dementia, Lewy body type dementia, which we'll kind of talk about separately, Parkinson's dementia, vascular dementia, frontotemporal. We see these sleep disturbances in all of these, and really for any in the mid stages of those is where we start to see them start to present, or they're harder to manage, or in the mid stages. When somebody's having sleep disturbances, however, it also means that their primary care partner or caregiver at the time is also probably having sleep disturbances as well, as their sleep is disrupted. And they go hand in hand. So sleep disturbances and sundowning go hand in hand because a sleep disturbance can be a cause of somebody potentially sundowning, and sundowning can be a cause of somebody potentially having a sleep disturbance. So that's why we've put these two together. And it's important to understand that as we're walking through this, what's happening to the brain of somebody with dementia and why this might potentially be causing sleep disturbances and sundowning. So we see here, and those of you that have been on our programs before have probably seen this illustration, but you have the healthy brain. Our healthy brain is 3 pounds. And somebody that's experiencing dementia or is in the later stages, or as the brain or the disease progresses, the brain in the late stages, or if they pass away from dementia, will be 1 pound. So we're going from 3 pounds to 1 pound. And as that happens, there's going to be a lot of changes that happen. So there are permanent changes, structural changes that happen, and you can see the brain shrinks, it becomes smaller, the ventricles enlarge, the outside, kind of the wrinkles, the crevices in there, they're going to enlarge as well. And also as that happens, chemical changes are going to happen too. That gray matter and white matter and other chemical, how the brain wires and fires together, it's going to change as all of these other changes happen. And it is as the brain is losing, or there's a degradation of, or a loss of those neuronal pathways, how those neurons talk to each other. The brain controls everything. So those neuronal pathways that are being lost or starting to lose, they really help maintain our sleep. They can maintain our sleep-wake cycle, so that circadian rhythm, or I've heard it called the pacemaker rhythm of our body, that can change. Sleep changes can help us go to sleep. What helps us go to sleep, what helps us stay asleep, is all going to change and be impacted as the changes of the brain are also occurring. And again, all these sleep disturbances are observed in persons with dementia. So when we're talking about sleep disturbances, really we're talking about sleep deprivation for the most part, because if we have any type of disturbance, there's going to be a deprivation in the sleep, the amount of sleep that we get. And it can be quality sleep and the quantity of sleep as well. When that happens, there are a lot of safety concerns that can happen for both the person living with dementia and the person taking care of them, right? You're going to see more confusion. And really, if you think about this, if you think about you've ever been sleep deprived or not had some good sleep, I can think about a time where I've been sleep deprived and have more confusion. I'm not as able to control my emotions, and this is the same for somebody with dementia. So you will see more agitation and more irritability, maybe more quick to anger, right? Not able to think as well, reason things out, concentrate on activities or tasks that you're doing, just doing things, and more errors in judgment as well. This comes into, it's harder for us to make good choices. And a lot of this has to do with the hormonal balances when we're sleep deprived or not, and what hormones get turned on or turned off, or they aren't working as well. So it is hard for us to make good choices and have that motivation to go exercise or to get up and go walk. We're tempted more to eat food that's not so good for us, tempted more to eat more, for one thing. We don't have that feeling of fullness or hunger, or that's being satisfied feeling. There's also the craving for sugar that happens, or salt, those cravings that aren't quite as good for us will happen more often as we're sleep deprived. Our bodies, when we have sleep depression, are not able to fight off illnesses as well. It really does cut the immune system in half, really any type of loss of sleep that we get. So we can't fend off illnesses as well, whether it's the cold or the flu or an infection of some sort. And it can take us longer to recover from those illnesses too. And then there's increases in depression and anxiety that come along with sleep deprivation. Our body can be inflamed all over, depending on that. And then what we really see, of course, with persons with dementia is there is an increase in severity or worsening of the dementia that they already have. So typical disturbances you may see. So what a sleep disturbances can look like is they may sleep too much. And this can be up to 16 hours a day. And again, this is when there's a sleep disturbance, it's a disturbance in the early stages and middle stages. Persons with dementia in the later stages of the disease will sleep more often. And that's a natural progression of the disease and not necessarily something to be concerned about. We have to think about where their brain is and all the changes that have happened to them in those late stages of dementia. The brain needs more rest. It can only handle so much. So this is really more if they're sleeping too much in those early stages or middle stages of the disease. Or it can be the opposite and they're not sleeping enough at all, maybe 2 to 4 hours a night, and they're up the rest of the time. They can have their days and nights reversed. So they're sleeping during the day, but awake at night. They might wander during the night. So they get up and they're wandering and they're hard to redirect to go back to bed, or they're not aware that it's time, it's still nighttime and they need to go back to bed. It can be because they get up to go use the restroom, but it's more than normal. You know, it's a different than their baseline or what they have been doing. They may not want to go to bed or understand what time it is and that it is time to go to the bed. The body is not giving them those cues, and maybe their environment is not giving them those cues as well. They may not want to put on their pajamas to go to sleep. They may not want to go to the bed to go to sleep, but they'll sleep somewhere else. Another thing you can see is experiencing nightmares, or they have vivid dreaming that they may act out, which would be different from something in their past. Or they can confuse any dreams that they may have with what's happening in reality, or when they're awake. And if they're diagnosed with a Lewy body dementia, those individuals with that particular diagnosis do have more sleep disturbances that we see early on, which we'll talk more about here in a second. So other causes that we can see, and we saw the picture, there's brain changes that are happening in somebody with dementia. They can be, again, disoriented to the time and not aware how much time has passed during the day, that it's evening time, nighttime, morning time. That awareness of time and where we are in the day changes for somebody with dementia pretty early on. Again, their days and nights can be confused if they're in the later stages of the disease. Another cause of sleep disturbance is another illness that they may have, and it can be a short-term illness or a chronic illness that they may have. If it's RLS or Restless Leg Syndrome, and that feels like there's like a crawling on their leg or there's bugs, there's kind of just a general restlessness or anxiety-ish in your legs, and you can't stop that feeling that they have. Sleep apnea, so they have that irregular breathing when they're asleep, to where they may even completely stop breathing for a period of time while they're sleeping. There can be a UTI as well, or any other acute illness that's causing them to have some sleep disturbances. I want to talk about anxiety, depression, and stress. I think we can all probably think about a time in our lives where we've had higher than normal stress or anxiety or depression that really did disturb our ability to sleep, whether it was to go to sleep, stay asleep, or get good quality sleep, right? There's a difference between the quantity, which is important, but it's that quality of sleep that we need. And sometimes that's just stress and anxiety can prevent us from getting that good quality sleep. Persons with dementia are going to experience that as well. Pain, any type of pain or just being uncomfortable will really disrupt sleep. And again, those changes that are happening, those chemical imbalances that are happening inside the brain, that really can mess up that pacemaker within that circadian rhythm, that body clock that we have. And then, of course, medication side effects are a huge factor into sleep disturbances as well. And medication side effects, we'll talk more in depth about those, but it could, if they're causing drowsiness, or they can cause us to not sleep well. It can cause me more restlessness, so I'm not able to get that sleep that I need. And then as our lifestyle changes, or persons with dementia's lifestyle changes and how they're interpreting the world and what they're able to do. So are they getting as much exercise as they used to? What about how much has their diet changed or hasn't changed? Are they too bored? This is a big cause of sleep disturbances, particularly in the elderly, is that there's just not enough activity or stimulation throughout the day. And that can be physical activity, but it can also be mental cognition activity. It can be emotional activity, or even just that I'm giving a sense of purpose. I'm able to contribute to my community or my family. And if I don't have that, that can cause me some boredom or cause me restlessness, or it can cause more depression. And then I'm having some sleep disturbances because of that. Too much napping. Now we'll talk, there's a fine line between napping and what that looks like and how much, but sometimes we can nap too much to where we're just not tired at night, right? Or any change in the routine, which we'll talk about, and then a sleep hygiene. And I'm going to give all of you guys great ways to have a good sleep hygiene, whether it is for your loved one with dementia, your client with dementia, or it's yourself, to help with those. And then the environment. How has the environment changed? Has the person with dementia, are they in a new environment? Did they just move to a community, or did they move houses, or somebody moved into their home and it's changed the environment a little bit? Or maybe they're just not familiar with where they're at that time. Does the atmosphere not promote good sleep? Have we, I think about a person that I helped take care of, and he was on hospice for a period of time, but we had people coming in just helping him out before he was on hospice. And he was in his home, in his room, but we changed the atmosphere of his room so much. First of all, there was a lot of people in and out that can really be confusing and disruptive through all hours of the day and night. But then just the equipment that was brought into the room. There was the oxygen machine that was in there. We brought in extra heaters to keep him warm, right, that were in there. There was also a fan that had to be brought in for the care partners that were staying to watch them. There was just all this extra equipment, storage over here in the corner, I can remember for medical equipment, or even like bandages, and his medication were over here, but that was all in that room. And it just changed his room, like his space a lot. And I really think that disrupted his confusion and his environment, and it disrupted his sleep patterns and his sleep, and gave him sleep disturbances. Too much stimulation. Again, is there too much going on in the room, or is there too much going on throughout the day? Have you ever experienced where I've had such a busy day and so much going on that I've become restless, or it's hard for me to come off of that high energy, or that rate that I'm going every day? So it's hard for me to come down off of that. Of course, the comfortableness is in a new environment. How much noise is going on? Is it too loud? Is there too much light? Or is there not enough light? You'll see a theme here about some light throughout this presentation, that if they had limited exposure to whether it's bright light or sunlight, that light really tells our brain and kind of helps set a rhythm for us. It tells our brain when it's time to be awake, and it tells our brain when it's time to wind down and that we need to be asleep. So light plays an important factor into sleep disturbances and sundowning. With Lewy body dementia, I mentioned, so if somebody has a Lewy body dementia diagnosis, this is a common factor, a common hallmark symptom of this particular type dementia can be sleep disturbances. So with Lewy body dementia in the earlier stages, it may not be that we see somebody has a lot of short-term memory loss, like you might see with an Alzheimer's type dementia. A symptom you might see is somebody with sleep disturbances. So, and what it typically looks like is they have very vivid dreams, or they act out their dreams. And again, this would be different than their normal, their previous or their normal behavior, but they may yell or scream out during their dreams. They may actually move, like hit or kick, or, they're defending themselves, or they are acting out whatever they're dreaming in there. So you might see some periodic limbic moves or limb movements. So they're jerking or whatever it may be inside those dreams. And again, they can have a hard time, whatever they dreamt, they may have a hard time separating that from, that was just a dream that I had, from this really happened to me. And of course, that can be scary and confusing. They can also are more prone to having restless leg syndrome, but then you can also see they're just more excessively drowsy during the day. So these are, and this is because this particular type of dementia is affecting different areas of the brain earlier on. So you will see some more sleep disturbances because it's messing with those areas of the brain earlier on in this dementia. Whereas with an Alzheimer's disease or even a vascular dementia, you can see sleep disturbances, again, mid stages, more in the middle stages of the disease. So we first want to rule out or treat any of those automatic things that we can treat or rule out. So whether that is an illness, do they have a UTI? Particularly if you've noticed a sleep disturbance has come on suddenly, or it's an acute change in them. Now, sleep disturbance, it may be caused because of the changes happening in the brain, but we do want to make sure and rule out it's not an acute illness, a UTI, an infection. They've got acid reflux that they're not able to tell you about, or GERD or something, so that's hard to get them to go to sleep, or when they lay down flat, that really, really bothers them. Well, those we can fix pretty quickly. Other pain that they may be having, if their arthritis is acting up, or, even the changes in the weather. Right now here where we're at in Texas, there's a lot of changes going on in the weather. The bariatric pressure can cause some changes in how persons respond to fatigue or restlessness or whatever it is. But we have medications or other things that can help manage that. And it says here pain, of course, physical pain, but emotional pain as well. We briefly talked about depression and anxiety and stress. Well, how can I meet the needs of that particular pain or those particular needs that need to be met, and help them through those things so they can get better sleep? So do they need to talk about it? Do we need to do some like meditation therapy with them, or pet therapy, or maybe it's reminiscence therapy, and we do that with them so that, have they're able to work through some of those emotions or feel like they are able to contribute back to their community. And so it lessens some of those feelings of depression, and they can help with their sleep disturbances. Medication side effects. If we can talk to a doctor about what the possible side effects are of medications, whether it's prescribed by a doctor or it's over the counter, we can talk to a pharmacist about that and maybe either change the medication or change the time of the day that we take it. If it does cause drowsiness, can I take it at night? Or if it causes me to have a little bit of restlessness or anxiety, should I take that in the morning? When just talking to that doctor and really brainstorming out, the medication is important, but I want to make sure it doesn't, but these side effects, I don't want the side effects to interfere with other things that can cause more upsetting behaviors. But also looking into their sleep history and habits. What has been their sleep history? Have they always been a night owl? So they always stayed up really late at night, and that was just kind of how they were, and maybe they slept in a little bit more in the morning. Or maybe they stayed up late at night and they did nap throughout the day, but that's a history of theirs and it's a habit for them. Well, we need to look at that, because that might be how we incorporate this into their daily lives now. Other habits, and then looking at rituals too. What do we do right before we go to bed? How do we start to wind down and get our bodies and minds ready for bed? And what did they used to do in the past? Is it reading a book? Was it drinking a warm cup of tea? Was it going around and checking all the doors to make sure they were locked a couple of times, like the house is secure, now I can really get ready for bed? Is it little things like that that we can incorporate into their day or into their sleep hygiene, their sleep routine? And the depression and anxiety and stress, making that environment stress-free, especially doing some calming activities a few hours before bedtime. And be aware of what they're watching. Is it the news? Is it something a little bit more upsetting, or that could be misinterpreted? Because what we watch, this is the same for you and I, but same for persons with dementia. What we watch is going to interfere or influence on what we think about. And that's important, particularly when we go to bed. What is on my mind as I'm going to bed, or what did I just see as I'm going to bed? Because that can influence how fast we go to sleep, or what we dream about, or how long we stay asleep. We'll talk about compassionate touch and how just soothing touch and reassurance can help with sleep and sundowning as well. Again, have they snapped too much throughout the day and they're just not tired anymore? Or have they not gotten enough stimulation? Whether that's exercise, just movement throughout the day. We don't have to go, walk every day, but just moving, getting up out of that chair and moving through the house every day. And cognitive and emotional stimulation too. With exercise and movement, the body does have to be able to burn off that energy that it has, the metabolism, they're still there. They need to burn off some of that metabolism. And if we don't burn off enough, it can keep them awake because we have that energy there. Also, exercise and movement has shown over and over again to reduce depression. So with this movement and exercise, it can really work at two different, if not three, it can help reduce stress as well and anxiety, help from three different areas for that. So it is planning. It's just making a part of your daily routine, whether it's getting up and going for a walk, or we're doing stretching in the chair, or we are doing some gardening. It also provides the opportunity for us to get outside and get that light that I mentioned earlier. So the skin soaks up the sunlight, and that helps really the brain reset and say, okay, this is the time I need to be awake. And it's part of setting that circadian rhythm, or that pacemaker that's inside of our bodies that's controlled by our brain. And a diet. So our food, what we eat, when we eat, how much we eat will play into our sleep. So eating a well-balanced diet that is healthy and makes us feel good. If I'm eating too much of one thing, whether it's sugar or salt or fat, that can influence how my body feels. And if my body feels uncomfortable, again, that can play into my sleep patterns. Cutting out caffeine. I would say if you can cut out caffeine altogether, go to half caffeine or decaf over time, or at least cut it off by noon at the latest. Because as our body gets older, it takes us longer to metabolize things out of our system, and that includes medications and it includes caffeine. So it's just going to take it longer for us to get that caffeine out of our system if it's still part of our daily habits. Stopping liquids after dinner, and this will help play into how much time they get up, or how many times they get up during the night to go use the restroom. And I want to be leery on saying we don't want to stop liquids altogether or stop them in the middle of the day, because we don't want them to become dehydrated. But it might be after dinner, we've had our liquids, and then that's about it for now. And then they do use the restroom right before they go to bed, and that can help minimize how many times they get up at night. Limit alcohol and nightcaps. I know there's a thought that nightcap can make us drowsy, and it does. For a lot of people, it does make us drowsy, but what happens is alcohol prohibits the brain to shut down and go into the quality sleep that we need. So the alcohol prevents us to going into those REM cycles. And we have to go through certain REM cycles in many times over the night to get that quality sleep. And alcohol is a prohibitant to getting into those REM cycles. So being aware of that, whether it's for your loved one, your client, or yourself. And really being aware of what the environment is and what it's communicating. Persons with dementia are very sensitive to visual cues, but to their environment around them, what's going on. And also as the disease changes, how they interpret their environment's going to change as well. So there are some basic things like, is it too hot or too cold? Colder temperatures for all of us do promote better sleep. So I will say people with dementia, our body's temperatures change a little bit too. So they tend to operate at their body temperature is already kind of lower. So being aware if they're too cold, it may be too hard to go to sleep. So you might think, gosh, they don't need those 3 blankets because it's August and it's 100 degrees outside. But to them, it might be just right. Mm-hmm. Is the mattress uncomfortable? Is there, the sensation of the fabric on the skin can change as well. So what's the fabric and how soft is it? Using weighted blankets can also be a comfort to people with dementia. Again, this is individualized, but it can be very comforting to have a light weighted blanket on them because it can help soothe and comfort physically, but also emotionally. There's a secure feeling about that weighted blanket, and that can really help promote sleep and help us stay asleep longer, and maybe help them want to go to bed because they have that feeling of, ooh, I really like how it feels when I have that blanket on me. Whether they're able to say that or connect what's happening, but that feeling of security and comfort's there. And making the room familiar, friendly, and functional. So it's a room they can get around in on their own. It's friendly, it's a place they want to be, and it's familiar. It's their space. They know the people that are on the pictures on the wall. They know that blanket that they've had since they were a little kid, or that chair in the corner that they grew up in their previous home. I've always had that. So it's a familiar place. And there can be too much light or too much noise. A white noise machine can help, particularly in a crowded home or in a community or something. If I turn on that white noise machine, it can drown out other background noise. And then using night lights to help them find their way, but being aware, is the night light helpful or is it not so helpful? And this is just an individual setting. Right? Again, talked about that exposure to light during the day. In the light, whether it's a bright light or it's sunlight, really is a cue to our brain that this is wakefulness. And again, it helps that brain kind of reset that circadian rhythm as it needs to. Keep those lifelong rituals and routines. And then incorporating some more calming things, whether it's a slow stroke back rub, or it's a hand massage or a foot rub, because that really helps people relax. It helps decrease a stress hormone in the body, and it helps increase an oxytocin hormone. And the oxytocin hormone is a care and connect hormone. So it promotes feelings of safety and security while we're decreasing that stress hormone. And this is through skin to skin contact, palm to palm, whether it's palm to the back, palm to the feet, a hand rub. It's been shown over and over again that body goes through the physiological response when we do that. And we call this compassionate touch. There's no, you don't have to be a skilled massage therapist or know anything. It's just knowing that my palm to their skin and being slow, I'm rubbing their hands, I'm rubbing their feet, their back, really does promote these responses in the body, which helps promote calmness. It helps promote or decrease depression, decrease anxiety, and again, will help with those sleep disturbances. Turn off all the electronics about 1 to 2 hours before you go to bed. So this is turning off the TV, the bright lights on from the TV, that different kind of light that it sets off. Turn off the computer, turn the phone off, turn off, if you're reading a Kindle, maybe you put it on the reading light for that. Have on the radio so there's not a light coming out, but it's really setting the environment for calm and reassurance. If they get up in the middle of the night, gently remind them that it's nighttime, redirect them back to their bed. So it's a visual cue. Hey, it's still nighttime. I need to see the bed. Maybe you show them outside that it's still dark outside. I've had to do this and just show, like, open the curtains and say, yeah, there's just a few more hours. It's still nighttime. Let's get those few hours of extra rest. It's going to be great. And I had to show them what time of the day it was because they were so disoriented. Again, confusing nights and days, but that helped cue them in their brain because they visually saw it, as opposed to my words of just saying, well, it's still nighttime. We still have several hours of night to go. So why don't we get back to bed? It's that showing them, and it's cueing that visual cues to them where they need to be. And for caregivers, particularly if you're there, a family caregiver, or they're at home still, and it's 24/7, finding different times for you to get rest. Sleep when your loved one is sleeping. If we're still working on getting into a routine, or if they are napping, then maybe you can nap too. I would kind of skip ahead. Sleep in a different room if you need to, or if you can. Using a room monitor. I know a lot of families that use room monitors or noise monitors because I'm in a different room, because I'm not as restless and neither are they, but I can hear them in case they get up, or I can see them in case they get up, and I can judge from there whether I need to get up or not. Make sure that the house is safe and locked up. So if they are prone to getting up in the middle of the night, it can be okay. It's kind of choosing our battles here. It's okay that they get up if they're able to, as long as they're safe and they're not going to walk out that front door or get into the garage and start up the car or something, right? Just make sure the house is safe and locked up. It's okay if they wander around a little bit, if you can't redirect them back. And choosing those battles. So if they're going to sleep in the chair, then let them sleep in the chair, right? If they don't want to take their clothes off, or it starts to become a fight, or it starts to become a battle, then let's not have that battle. Let's just say, you know what, you're right. I'm going to let you sleep in those clothes. If it's the same clothes they've been wearing for the past 7 days, that's okay. Let's just, next time they're in the shower, let's swap those out or make sure they get cleaned, right? But that's okay. It's kind of, if they're going to go to sleep here in this chair in their jeans and they're going to sleep, then I'm going to let them sleep, because that right now is the most important goal, to get them to sleep. So the sleep hygiene, again, this is for everyone. This is for our clients, our loved ones, but it's also for you. And knowing that good sleep hygiene is a day-long process. So it is, you want to wake up around the same time and go to bed around the same time. You don't have to be militant about the time, but it is, within an hour of each other. I'm waking up in this hour every day, and I'm going to bed with this hour every day. And you can train your brain to do that. Getting sunlight early in the day. So again, that's that light, that exposure tells me, oh, this is the wakefulness hours. And of course, exercise. It improves our quality of sleep, and it can help us feel drowsy. I say in this, particularly for everyone, the best time to exercise is the time that you're going to go exercise. But with persons with dementia, because it can excite you and keep you awake for a longer. So make sure it's at least 2 to 3 hours before you go to bed, if you're actually doing physical exercise where you're sweating and working your heart rate up. In the evening, it is watching what those stimulants are, and that stimulant can be food, it can be alcohol, it can be what's on TV. Just watching the stimulants and really avoiding them altogether, if not limiting them. And use the bed for sleep. If some of you use the bed for work, or you use the bed for watching TV, our brain will associate the bed with those certain activities and not necessarily sleep. So really just hone in, if I'm in that bed, I'm there to sleep. And do your other activity, watch the TV somewhere else, do your work somewhere else, because the brain will associate what it needs to do when it's in that environment. And go to bed when you're ready to sleep. If you need to do certain exercises to calm yourself down, whether it's reading a book, for some people, I know some people play games on their phone to help them kind of calm down a little bit, do that somewhere else. And when you're tired enough, then you go to your bed and sleep. But give yourself time to ease into that sleep, because sometimes I know, particularly caregivers, we're going and going and going and going all day, every day, all day, every day. And then it's 10 o'clock. Oh man, I need to be asleep by 10:30. So we expect everything just to stop and our bodies to calm down and our brains to calm down within 30 minutes, and we should be asleep. Doesn't typically happen that way for a lot of us, or at least it doesn't for me. It can take a lot longer. So backing into that time and saying, okay, I need to calm down earlier than 30 minutes before I really want to be asleep. And what can I do? How can I ease into that? I need to turn off the phone. I need to turn off the TV. Maybe I just turn down the lights in the house a little bit, if that's helpful, and create those relaxing rituals for me. Is it drinking that cup of tea or a warm cup of milk? Is it going around and shutting down the house and making sure we're all locked up, everything's good? I have lunch packed for tomorrow, so I'm setting those routines that help me get ready for bed and set my mind ready for bed. If you can't fall asleep within 30 minutes of getting into bed, then we want, again, bed is for sleep. So get out of bed and go do some calming activity, whatever that is for you. Do that in another room, or do that in the chair in the corner of your bedroom. Do that for 10 to 20 minutes till you start to get tired again, and then go to sleep. If you still can't sleep after that, there are a few other approaches we'll talk about. So non-drug approaches. There are some relaxation techniques that have shown to help us go to sleep. There's a progressive muscle relaxation, and I will send y'all an extra form on exactly what this looks like and how to do that. But it's the tensing and relaxing of muscle groups throughout your body. Of course, meditation, and that's our mind focusing on nothing or focusing on a particular word like peace or sleep or love or stress or no stress, and our mind just focusing on that for a while. And then guided imagery. And this is a form of medication, but it's our mind going into another place, using our mind's eye to visit a calming place, right? To help us be more relaxed. And this physiologically helps our body go into a relaxed state. All three of these are shown to help us promote good sleep habits. If all else fails, I'm going to talk a little bit about medications, and I'm going to preface this. This is just for educational purposes only. I am not a doctor. I am not a sleep expert. And with any medication, you must consult a doctor first, consult with your pharmacist as well, but also know persons with dementia are more sensitive to sleep medications. So is just the older adult in general. So we always want to start low with any type of medication and go slow. If you need to increase the dosage, you go very, very slow. And really know what the side effects are and weight them against what the benefits are. So what are the pros and cons, or the risks and benefits of this medication? Because we know medication side effects can increase falls and fractures in just the elderly population, but particularly those with dementia. Because when you wake up, you might have slept well, but you wake up and you're still really drowsy. And it's kind of like, they call it the hangover effect. And that hangover does promote more falls and fractures, more confusion as well. It's harder for us to come off that medication. And then there can be a decline in cognition and the ability to care for oneself. So from the Alzheimer's Association, if sleep medications are used, an attempt should be made to discontinue them after a regular sleep pattern is established. So these medications really only need to be used for a short period of time, to when you have that sleep pattern established, and then you come off of them with the doctor slowly to keep that sleep pattern established. So the type of medication prescribed by doctors is often influenced by the behaviors that accompany these sleep changes. So it's really saying, here's the behaviors I'm seeing, here's the medication the doctor wants to prescribe me. So I'm talking with my doctor about this, the behaviors I want to diminish, how will it help the sleep changes, and really be in constant conversation with the doctor so we can diminish those behaviors, get those sleep changes fixed or managed better, and then start to come off potential medications that are prescribed. So the FDA, and this came from alz.org, the FDA has approved a medication for insomnia for people with dementia in the mild to moderate stages. Of course, it lists here possible side effects are limited to, but this is not an exhaustive list. There can be an impaired alertness, motor coordination, complexity, or worsening depression and suicidal thoughts, and then complex sleep behaviors. So they might do some sleepwalking or sleep driving, and then compromised respiratory function. So there are some side effects, but this medication has been approved to maybe help with that insomnia too. And really, when you're prescribed, or your loved one or client is prescribed any type of new medication, you always want to ask your healthcare team. So this is the doctor, the pharmacist, your care partner, what are the benefits of the medication? What's the risks of the medications? Are there other treatment options available? Or really, a question that should be added is, what's my goal? What is the treatment goal? Where am I trying to get? And how will this medication help with that? So. And then over-the-counter sleep aids, very quickly. And I hesitate to put this in here. Again, I'm not a doctor, I'm not a sleep expert, but I put it in here because I know people take over-the-counter medications for sleep. That's just kind of what it is, unfortunately. So there are the medications, the Unisom and the ZQuil, that help, and they're really older. They're antihistamines that have been used and kind of repurposed that will make you feel drowsy and will make you fall asleep easy. There's the Unisom sleep tabs. There are newer medications that kind of have the antihistamine drowsy effect as well, and they have fewer side effects. So those two first bullet points, they still have side effects, both of them. This has the increase for falls. It's that hangover effect that will still be there. They can have that complex sleep pattern, so they might be sleepwalking. You can see that, or sleep driving. You can see that in these. These are some side effects that have have been shown with these. Drowsiness throughout the day. But another thing is, with these, you want to, if you're using these for a long term, they're not really necessarily habit forming, so they say, but if you're using them for a long term, there is a link to increased risk of dementia. Okay, so keep that in mind, just really weighing the benefits of those. Benefits and risks of those medications. Melatonin and Valerian. Melatonin is a natural hormone that our body produces that we stop producing as we get older. or produce less of it, but melatonin just promotes sleep and helps us go to sleep longer. You can't buy this over the counter. It's a hormone replacement or supplement. And just talking to your doctor about adding that in the pharmacy, how much, because you can talk about the dosage, how much you want to do, because that has been shown to help promote good sleep. And valerian is the same. It's a plant-based supplement. It's a little bit newer, so we're just the side effects or the benefits of it just aren't really validated quite yet. So sundowning. So we talked about sleep disturbances and sundowning. And sundowning is really, it's a time of the day that refers to an increase of agitation or confusion in persons with dementia. And they call it sundowning because typically this increase in confusion and agitation really tends to happen for most people in the late afternoon, early evening. So as the sun goes down, we start to see these behaviors present in people with dementia. So they call it sundowning or sundowner syndrome. And it's very common in persons with late middle stage dementia, really any type of dementia. It's just they become restless. They may want to go home. They may just seem more confused, not able to communicate like they were earlier today. They're more agitated, right? They might wander around more. And this happens about the same time every day. Most people, again, it's early afternoon, late evening, late afternoon, early evening, but it can happen any time of the day. So I've known people that had these symptoms, the sundowning symptoms, early in the morning. But typically it's in that late afternoon, early evening. They may see people or hear things that are not there. So you're just kind of having that increase of dementia symptoms during that period of the day. So a lot of suggestions is, why does this happen? And it can happen because of sleep pattern changes in the body. People that are having disrupted sleep that we may or may not be aware of. They may be tired, or they're not getting that quality sleep throughout the night. So it makes them more tired as the day goes on. And as they're more tired, they're less able to manage their environment, but also their response or how they're behaving in their environment, or how they understand the environment too. They can just be reacting to the end of the day. Depending on their environment, the end of the day, most people, whether you're at home with a care partner or you're in a community around a bunch of care partners, we're all getting tired at the end of the day, right? So it's been a long day. We've had a lot of stuff going on, and I'm also tired. So me as the care partner might be exhibiting some tiredness or exhaustion or fatigue. So I might not be able to control my patients as much, or my, the vibe that I give off of tiredness is coming out more in the later afternoon. So they can be turning or seeing that and just mimicking that behavior. So this can look like what contributes to sundowning is exhaustion. They may be having a hard time understanding and hearing what's going on. What are they actually seeing? So another theory is this: as the sun goes down, it changes the environment. So there's different shadows inside the house as the sun goes down and the lights playing or making more shadows, or the light can play tricks on somebody's mind, or the outside environment is changing, and that can be confusing to somebody with dementia. And that can cause fear. If I don't understand why the environment's changing, that can be scary. If there's a routine change in the environment, just a change in the routine or a change in the environment at all, again, there's more people in. It could be a shift change, and so we have more people in and out. More people might come visit at the community at a certain time. So more people are visiting during dinner time. So you're having more people in and out of your environment. Or you're having more family and friends come over and help with that. Or you're just getting home from work, or the kids are coming home from work. So there's just changes in the environment. Too much noise, too much activity, or there can be not enough. And they haven't had enough activity throughout the day. We've talked about that boredom and that loneliness. And eventually that boredom and loneliness can make me seek out something to make me not bored, or seek out not to be lonely. I need a connection. I need something. So the brain will seek out something to do. And that may be a safety concern, or it may look like somebody's wandering around, or they're more restless, or they're agitated, and they can't tell you verbally why, and they may not understand why either, but it's that innate feeling that we have as human beings. They can be meeting formal obligations. Again, that time of the day is just busy for most people, most of our lives. Whether we're getting off of work and we're going home, we got to pick up the kids to go take them to soccer practice. And then I got to get home and make sure dinner is started, or I need to run to the grocery store real quick. So really, that's just naturally a busy time of the day. So they might be regressing back into remembering, hey, I should be doing something right now. I'm an important person. People are relying on me. I gotta be doing stuff. I got to get somewhere. They might actually even say, I got to go get my kids. I need to get home. I need to go to work. Or they might just be starting to move and be more restless. Again, they're not probably going to be able to tell you what's up. You can tell, they can if they are telling you, I'm trying to get home, or I got to go pick up the kids. People are working, I got to get out of here. Then you might be able to say, okay, they're probably trying to meet some formal obligations, right? If they're just feeling restless, or they're pacing, or they're wandering around, there's something they need to have. Either they're too overstimulated or not stimulated enough, and they need something to do. And they can just be confused about what's going on. And they may be looking for something that's comforting. So if they are looking to go home, or they are trying to find mom or dad, or where is my sister? They're looking for, home, mom, dad, sister, or friend, a pet. That is a form of comfort. So they might also be seeking out, right now I'm confused and more unfamiliar with what's going on. So I'm seeking out something that's comforting to me. And that might be home, and that might be mom. So the words that they're using are important. We want to hear that, but what's behind that? Are they seeking out comfort too? And how can we feel that in, that comfort and that support? Mm-hmm. And knowing that with sundowning, we may not be able to stop, just like with sleep disturbance, we may not be able to stop them completely or fix them completely, but we can maybe manage the symptoms better or alleviate the severity of it. So establishing a routine. And this is staying on that routine, helps with the sleep disturbances too, right? So this is getting up around the same time. Any appointment or activity that might be complex for them, or we need to leave to go to an appointment, or we're going to go do this, or we're going to exercise, it is best to do that in the morning time, where they're more able to do that. So they just came, hopefully got a good night's sleep, and they're able to manage that better. As the day goes on, they might be less able to manage those appointments and really understand and getting out from that. And if we can keep those in the morning, and then, we come back, here's lunch. We do a familiar activity after lunch, we get some rest, and we do, our morning or our routine throughout the day is the same, but making sure those more complex things happen in the morning can be very helpful. If we have to change it up for the afternoon, sometimes you will probably notice a change in agitation or confusion later on in that day. I had a lady I was working with. She was a teacher during the year. So her mom came to our day program, and so the mom was in day programs, daughter caregiver was teaching, and then summer came, and the daughter didn't need to be teaching. So she stopped bringing her mom to the day program because she honestly felt guilty about taking her mom to the day program while she wasn't at work. But she called one day, she said, Mom has just changed. She's been acting out in the late afternoon, and I don't know how to manage. She's more agitated. She starts yelling at me. She's wandering around the house, and I don't understand what's going on. So we talked through it, and we said, well, you've changed your mom's routine. She was used to coming to the day program every day, and that changed. She's just kind of stopped. So why don't you try bringing her back? You don't have to do it every day, but at least a couple of days out of the week, and see if that behavior, that sundowning, that agitation in the late afternoon changes and goes back. Well, sure enough, it did. Her mom's routine had changed, and that comfort, that familiarity, and she's getting social activities as well changed. But it's that I got to get back into that routine that's so important to me. And we all do better on a routine because there is familiarity, there is comfort around that routine. Whether somebody with dementia knows exactly what's going to happen next in the day, but they know this is familiar, this is comfort, this is supposed to happen, and I understand this. And then calming activities in the later afternoon, and it might be that you go out for a walk, or you might go take a drive in the car, or give them activities that they would be used to doing. So it might be helping starting dinner so they can stir some sauce, or they can fold some clothes, or they can sort through some bills, right? Or they could pull weeds, whatever it may be. It can look through photos that are familiar to them too. Snuggle with a pet. If you have that, there are robotic pets that might be therapeutic for certain individuals too, that can help with the symptoms of sundowning. Excuse me. If you are to prevent overstimulation or tiredness, take an early afternoon nap. Again, there's a fine line. We don't want too much napping, but a nap may help. It can help that over tiredness in the late afternoon. So it can help the brain kind of rest and reset itself. And that way they can manage the later afternoon a little bit better and help them be more in control of their emotions. Activity throughout the day. And I would say when you're looking at a routine, I would incorporate equal parts activity. And this is physical, mental, emotional, social, spiritual, all of those activities that are important to a human being. But also incorporate equal times of rest too, rest and restoration. I'm not rest necessarily a nap, but just rest of, I'm going to sit down and just look at the birds right now and take in this fresh air. It's because it's restorative, and all human beings need that as well. Persons with dementia can lose track of where they are. Again, lose track of the day, right? But just where they are, even if they're in the house they've always grown up in. There are times where it can be unfamiliar to them. If they get up to go use the restroom and they may not know where the restroom is, and that can be scary and confusing and make them feel nervous. So that can contribute to symptoms of sundowning. So maybe we start to label the house and help them orient themselves to where they're at. And that might be a picture of a toilet on the bathroom wall, or it might be leaving lights on in the house so they can see where they're going, right? So we're not having these shadows potentially created, and shadow can be interpreted as something more ominous. And they might not be seeing a shadow. It's, well, there's a dark hole or a dark corner over here in the room, and I don't like that. It's a little bit scary. So it's what they're seeing and how they're interpreting it is going to change. So making sure the environment is calm and it's organized and it's familiar and it's functional. I said that earlier. It's functional. They know what to do when they go into their bedroom. They know what to do when they go into the kitchen. It's a functional thing. There's not too many things out. It's easy to manage. And it's familiar and it's friendly. It's a place they want to be. I would say for the environment, if they are wanderers or they like to pace, that's not a bad thing. We just want to make sure it's safe and make sure that they're okay. They're not trying to meet obligations or they're trying to look for the restroom or something, but it might help them to get up and expend some energy and be walking around. So make sure it's safe. And that can be anywhere from removing area rugs so they don't trip over them to making sure the doors are secure, right? That the rooms are well lit. And they can sometimes have a hard time distinguishing between objects, whether it's and it's similar colors are hard to distinguish between. So it might be, if I don't want them to go out a certain door, like a door to the garage, I might color that door the same or paint that door the same color as the wall because it's hard to distinguish between that, or put something over the doorknob so they're not prone to going out there or drawn to going out there. So little things like that. And what are they hearing? Are they hearing something on the TV that can be upsetting, or they're seeing something on the TV that can be upsetting? What about conversations that are going on in the house or the community? Are those upsetting or are they confusing, right? So keeping the environment simple and quiet. They're less able to filter out background noise. So the quietness of the environment is important because there might be, particularly in a community setting, you got the kitchen noise from the kitchen, you got the TV on over here, you got conversations going on over here, people in and out the service hallway over here. It can be very loud and overstimulating. So being aware of what the noise level is on that house or in that community or in that room, whether it's a family home or family room. And I would say set aside a space for just them. And it can be their bedroom, right? But it's a space that's safe, it's familiar, it's theirs, and they can go and calm themselves down, or they can just go and kind of exit and be away from a lot of stuff to help with those sundowning syndromes or sundowning symptoms. Avoid restraints. This is chemical and physical restraints. And we want to be reassuring in how we say stuff. So it's firm, but it's calm and it's reassuring. And it might, they can't remember that they can't remember that they can't remember. and they can't remember reassurances either. So we want to keep saying those reassurances that you're safe, you're where you're supposed to be, we're here together, and making sure that that's in a calm voice. We don't want to argue with them or tell them that they're wrong, or that if they're looking for their mom, that mom has passed away and you're here now. Using those therapeutic stories as needed. I haven't seen mom today, or mom's working late. She's going to come home later. I could really use your help over here. Can you do this with me? I need your help. So making them being a part of that community or part of the family and giving back to them, or for them to give back to us. And physical touch, again, going back to that, maybe I hold their hand and rub it, or I put my arm around them and do a small back rub to help calm and soothe. Again, that puts our body into that physiological response. Exercise, dinner, or the diet that we have, and having that safe space for them. But caregivers have to care for yourself too. And I'm gonna end with that. Sundowning is exhausting for both parties, and it can be scary for both parties too, for the person with dementia and yourself. So it's important that you take care of yourself so you can best manage when some of those sundowning symptoms happen, and you can better care for your loved one or your client or resident. And that is eating, it's exercise, eating a well-balanced diet, it's getting good quality sleep, everything we've recommended for persons with dementia. And then seek out professional support as you need it. And that could be, do I need to incorporate a day program? Do I need to get somebody else in here to help me manage during a certain time of day? Getting a companion in here. Do I need to have somebody during the day to help take them to the gym? It's these things to help for that professional support. And talk to a doctor. It could be a medication that's causing this, causing more confusion or causing that drowsiness, and they don't know what to do with that, or just the side effects of a medication at all. Or if it comes down to talking to a doctor, is there a short-term medication that can help me? Because I've tried all these non-medical approaches, and I'm doing compassionate touch, where it's a calm environment. We're doing aromatherapy. We've got pets, we're snuggling up with our pets. We're doing all of these things. Is there something else that could help them if it's to a point where they're very confused or very agitated or very scared, and talking to them about help calming them during those times for a short period until they're established, or the sundowning phase has passed, right? And making sure they're not sick or they're not in pain. There's not a UTI or an infection or anything like that, constipation, you name it. And if it is the sleep, they're not getting enough sleep during the day, that can be causing these symptoms. And of course, if they suddenly become worse, again, it's that acute change. When it's an acute change or a sudden change in our loved ones, they're suddenly more confused, or they're suddenly more agitated or restless, then generally there's an underlying physical problem for that, and we can get immediate help. So here are some references and articles that I referred to, and our information here at the West Center. And I know I'm a few minutes over, but are there any questions? If you want to unmute or put those in the chat, I am happy to question. Oh, there are some questions here. And apologies for not knowing the concept of sundowning. I hope I cleared up what the concept of sundowning is. And if I haven't, please let me know. But are there other questions or comments that anybody has? All right, well, I appreciate it. Thank you. I will send out the email this afternoon with a copy of the slides, a copy of the recording, our upcoming programs. And we hope to see y'all on another, and the evaluation for the CE credits. Please do that. And we hope to see y'all on a future program. Thank you so much. Thank y'all.